Okay, so ginger, it will open up the blood vessels so that it will make it easy for the heart to pump the blood. So when the heart, you are making the heart's job easier. So then when once you do that, then the heart will find it easier to pump. The load in the heart will reduce. So naturally the heart attack will stop. So why heart attack is happening? Because the heart muscles are overloaded. If the blood vessels expand, then the load in the heart will reduce. So consequently heart attack will stop. Within a few minutes it will stop. Now of course this is for emergency purpose. Now you can't rely on ginger every day. I mean ginger cannot be taken as a daily medicine now for the heart, because for treating the heart you also require some medicines for strengthening the heart. So like the most common medicine in Ayurveda is Arjuna. That Arjuna trees we studied in that Krishna Damodar pastime. So the bark of that Arjuna tree is used for treating the heart in that. So you have to take some medicine like Arjuna Rishta or something like that for long-term treatment for the heart. But for the emergency purpose, you can use ginger. So another home remedy you can use is immerse the legs in hot water. So you take a bucket of hot water and immerse the legs. You heat the water up to 42 or 43 degrees and immerse the legs for about half an hour. So this also does the same thing. The heat in the lower legs, it will expand. It will expand the blood vessels. Once the blood vessels expand due to the heat, again the blood flow will improve and the load in the heart will reduce, and the heat will again balance the water. So lower leg hot water immersion, and also chewing the ginger till the tears come out. So in Ayurveda, what you can do is you can do for emergency purpose, you can massage oil on the chest. You can use warm mustard oil, because mustard oil is generally it's warm in nature, and you just heat it a little and apply in the chest. So that will again neutralize the vata in the chest. And there is one homeopathic tonic called SBL tonic card gold drops. So 40 drops for every 10 or 15 minutes till the patient's condition stabilizes, till till the condition stabilizes. So now the question is that suddenly if this happens, in what sequence you are going to do this? Now I talked about lower leg hot water immersion, I talked about ginger, I talked about oil massage, warm mustard oil massage in the chest. So let's say these three things are there. Okay, suppose that let's say you don't have the homeopathy tonic at home. You have ginger, you have hot water. You can heat up the water, and then you have mustard oil also. So you want to think which one should you do first, because remember this is an emergency condition. So which one will you do first? And anyone wants to try? Huh? Yes, very good, Prabhu. Sanjay Prabhu, yes. Chew ginger first. Why? Because ginger is that you can do very quickly. You can just pick up the ginger from the kitchen and put it into your mouth. Because lower leg hot water immersion, it will take time, because you have to heat up the water, you have to switch on your geyser, and it will take at least 5 minutes for the water to heat up, the geyser water to heat up. And we don't want, because if it is a chest pain, heart attack, and we don't want to take risk, we don't want to waste 5 minutes also. So first chew the ginger. You put the ginger into the mouth, then you go and switch on the geyser, or somebody else at home can switch on the geyser, and while the water is heating, you can chew the ginger. While the water is heating, you can and you are chewing the ginger. So parallelly, somebody can heat up the mustard oil and give it to you. You can you can give it to that person. He can apply on the chest. So and while you are applying the oil in the chest, meanwhile the geyser, the hot water will get heated up, and after that you can immerse your legs in hot water. So it's not that you have to do all of these three things. Sometimes, most often, ginger alone will be sufficient also. But still, we don't want to take chance. So we will try whatever is possible. Now, after you have chewed the ginger, okay, now this ginger is very spicy. And suppose later on, after a few hours, after 2 hours, again some problem happens. Suppose. Now, again and again chewing ginger will be difficult. So in that case, you can use this homeopathic tonic, this SBL tonic or this tonic. And The good thing about this tonic is the good thing about homeopathic medicines is you can take it every 10 minutes or every 15 minutes also if it is a very extreme situation, and it will not have any side effect. So that you cannot do with allopathic medicines, and even Ayurveda also you cannot do overdose. I mean, you cannot take it every 10 or 15 minutes. So that way, in such situations, homeopathy will be good. So that is the reason we are covering multiple remedies here from multiple alternatives, homeopathy, Ayurveda, home remedies. So depending on the situation, you can see which one you can do first and which one you can do later. So okay, any questions on this heart? Any questions on this?
So, is it severe not required to do this?
Anything like severe, what you mean severe heart attack?
No, severe, they know that press heart.
You mean the severe chest pain? Oh, okay, okay. Oh, okay, okay. Okay.
Trained reception.
Oh, okay. So, so for that you want to, okay, that, okay, got it. So, no, that it is generally better to get a trained person to do it. Okay. So this actually is, this is just only an emergency situation at home, which you can do till you can get help from somebody. Okay. So initially I was not able to, hear the audio properly. Okay, now I got it. Okay. Yeah, okay. So CPR generally, okay, now I saw the message on the Zoom chat, okay, the CPR. So that, it is better to get a proper trained person there. So meanwhile, till that situation happens, you can do these things. And most of the time, actually, these things will be sufficient to control the, to temporarily stop the heart attack. Then after that, you can decide what treatment you want to do for the heart, for the cardiac problems. Okay, any questions? Any other question? Okay, now it is important to understand the concept also, like understanding what Vata has got to do with heart attack and what Vata has got to do with this ginger and hot water immersion and oil massage in the chest. Okay, so conceptually also, if you can think about it, if you have any questions, you can ask me later on. Okay, we will move on now. Okay, next is pain management. So generally pain is one area where the problem tends to be very severe, even though it may not, sometimes it may not be emergency, but still it may be very severe. And this is one area where we generally tend to use painkillers or something like that. But then these painkillers, we can't take a lot of dosage also, and it has only short-term effect, and also they have got side effects. So generally in the long term, painkillers have got side effects also. So is there any safe way of handling the pain through Ayurveda, homeopathy and some natural remedies? So that we will see now. So then we talked about Vata, Pitta and Kapha 2-3 days back. So now Vata pain is generally a kind of pain which is generally moving here and there. Like for example, due to gas, when you have stomach pain, so that pain will be radiating, it will keep moving, it may not stick to one place also. And it will be radiating, and it will be, and any kind of sudden injury, suddenly if you fall down, then the body is in a state of shock. Mentally also and physically also, we are in a state of shock. Generally, any state of shock generally suddenly increases Vata. So these kind of pains, Vata will get out of balance. And Pitta related pain is like external injury usually. Like suppose you fall down and you get injured and there is some bleeding. So in that spot, generally Pitta becomes high. And if there is some inflammation, some swelling and inflammation, reddishness in that area, that is also because of Pitta. And Kapha kind of pain generally will be a very dull pain. It is difficult to pinpoint the exact spot. Some whole area, there may be a slight dull pain, not very severe, but it will be dull and it will be spread across a particular area. So that is this kind of Kapha pain. So, okay. Somebody is asking about low blood pressure. Okay, low blood pressure, I will actually talk about it in a later slide. It will come later. After a few slides, it is going to come. But before that, I want to talk about high blood pressure. So this ginger remedy, whatever I told sometime back, this ginger and hot water immersion that I talked about in the previous slide, you can use for high blood pressure also. I forgot to tell you that. You can use it for high blood pressure also. So if your blood pressure is, let's say, 200 by 100, suppose, and if you are facing a lot of palpitation in the heart and you are facing a lot of discomfort, then again you can chew this ginger. Then within 20 minutes or half an hour, your blood pressure will come down from 200 to 160 or 160 or 150, and usually after that it will be manageable. And you can use this lower leg hot water immersion that I told, that also you can use it for high blood pressure, because it will expand the blood vessels. This ginger as well as the hot water, they will expand the blood vessels, and naturally when the blood vessels are expanded, the blood pressure will reduce. Generally blood pressure becomes high because the blood vessels have become very narrow and the heart has to put extra pressure to pump the blood. That is why generally the BP is high. So if the blood vessels expand, the blood flows more easily, the blood pressure reduces. So low BP I'll discuss after a few slides. So one person is asking about low BP and giddiness. So giddiness I will be discussing after a few slides. That time I will discuss low BP also. So the same remedies for heart attack can be used for high blood pressure also. Only that homeopathic medicine, that tonica HCl, that we will not be able to use for high blood pressure. So for high blood pressure, there is another homeopathic medicine called it is a sarpagandha, which is there in Ayurveda as well as homeopathy. So you can take it in homeopathic form every 15 minutes or 20 minutes till your blood pressure stabilizes. So we talked about heart attack and blood pressure, because high blood pressure, because those two are interrelated. Next thing, pain. So vata, pitta and kapha type pains I use. So one good remedy for pain is heat and cold packs. So when to apply heat pack and when to apply cold pack. So when it is an external injury, let us say and it is bleeding, and the bleeding is a little severe, that time you can use ice pack to quickly stop the bleeding, and you can also put some turmeric powder for the external injury, and so that time the ice pack will be good, and heat pack is generally good for any kind of internal injury. So externally, suppose there is no bleeding, but because you got hit by somebody or somewhere, you fell down, and you got an internal contusion or something, then heat pack will improve the blood circulation in that area. But don't use heat pack immediately. You can use a heat pack a few hours after the injury has happened. So now let's say you have fallen down and immediately you have to use some remedy. And heat pack, I'm telling you, use for a few hours. So what to do? What can be done immediately? So that immediate thing, in Ayurveda, there is one oil called Murivenna oil. Muri means injury and Enna means oil. So externally apply in injured areas. So let us say, for example, you were going outside in a road and children were playing cricket. Accidentally somebody was doing batting and accidentally the bat hit you, suppose. So this is an example of external injury. There will not be any bleeding, but external injury is there. Or suppose you slipped and fell down and you got hurt. There is no bleeding, but still you are feeling pain. So that is also an example of internal injury. So for all these internal injuries, wherever injury areas, you can apply Murivenna oils. So again, Kotakal brand is very good. The quality is very, very good. So Kotakal, they have Murivenna oil, or some other Ayurvedic shops will also have. You can keep it at home. So then there is one Ayurvedic medicine called Maharasnadi Kashayam. So you will get it in Kashayam form and also in tablet form, in both ways. So tablet form is generally little easier, you can just swallow it. It is very good for Vata related pains. So 2 tablets twice a day. And if you take Kashayam form, you can take 15 to 20 drops in a little warm water. In Kada, in a liquid form. So both the forms you will get. So this also you will get it in Kotakal and many Ayurvedic shops. Now, suppose if you feel that you are suspecting that there is a bone injury also. Of course, later on in X-ray it will get confirmed. But suppose if you are suspecting that there is any bone injury, you can take Lakshadi Gugulu. So it is very good for bone and healing bone and muscle. 2 tablets twice a day. So internal fractures and even muscle injury and muscle healing also. Suppose you may not know that whether it's a bone injury or a muscle injury until you do an X-ray. But till then you can take Lakshadi Gugulu also. But now Lakshati Guglu, you can take it okay twice a day or maximum thrice a day. You cannot take it very frequently. Okay, now for taking it more frequently, if you want to take a remedy more frequently for quicker relief, so there homeopathy will be very good. I will talk about it in the next slide. So meanwhile, now Shatadauta Ghritam. So this is a special type of Ghritam, a special type of ghee, which you can use for external burn. Suppose your skin is got burnt. For burn kind of injuries, Shatadauta Ghritam is very good. It will give quick relief from the burn. And scars also. Suppose after the injuries you are having some scars, for quickly healing the scars also, Shatadauta Ghritam will be good. Okay, now Lakshati Gugulu for bone and muscle healing, it is only, you can take it only 2 or 3 times in a day. But now suppose if it is a fracture or something, it will be a very severe pain. So from this severe pain, you want quick relief. So now what to do? Next, in homeopathy. So homeopathy, there are different, now I have given a big list of medicines for injuries. Now I will not explain I will not focus on the names of the medicines. Rather, I will focus on the purpose. So now there is one medicine for inflammation, there is one medicine for bone repair, there is one medicine for muscle strain and sprain and all. Then there is one medicine called arnica, which is for improving the blood circulation. So generally this pain generally happens because the blood circulation in that area is generally not proper. Or generally when you fall down and get an injury, that particular area needs more blood circulation. So when you apply heat pack also, the blood circulation in that area will improve because the blood vessels are expanding with the heat. So heat pack is one way. Then this medicine called arnica, homeopathic medicine, this is another way of improving the blood circulation. Now suppose there is a nerve injury. Now when there is an injury, you don't know whether it is the bone or whether it is the muscle or whether it is the nerve or whether it is some tendons. So you don't know what to do. I mean, initially you are not sure. Later on when you take X-ray, you will come to know whether it is bone injury or not. But for the time being, let us say suppose you don't know, then you can make a combination of all these medicines that I have listed here. I mean, not all the medicines. Let's say this hypericum is for nerve injury, arnica is for blood circulation, rustox is for strains, pain, muscle repair, and symphytum is for bones. So these 4 medicines, hypericum, arnica, rustox, symphytum. So these 4 you can make a combination and keep it at home. I mean, you can prepare it, and keep it at home for emergency purpose. So suppose somebody has a fall and or an injury, he can just take about 4 drops of this mixture every 20 minutes or every half an hour. So if you take this every 20 minutes also, after maybe 1.5 or 2 hours, you will have a good amount of reduction in the pain. And by the end of the day, I mean at least by the next day, the pain will have significantly reduced. It will somewhat come under control. And suppose if there is some inflammation in that area, then you can use belladonna. You can add belladonna also to your combination. Now, why I am telling this keeping at home? Because you may not have time to go to some homeopathic clinic also in such a case. Suddenly, so suppose a doctor is not available and maybe the compounder doesn't know this particular formula. So then you may be stuck. So it is a good idea to keep this at home. It is not only for fracture, but any kind of injury when you fall down. And this kind of combination is also useful as a general painkiller. Now I'll tell you something very interesting. As devotees, we generally go for parikrama. So like Govardhan parikrama or this Padayatra generally.
Vrindavan.
Yeah, in Vrindavan, Govardhan and all. So parikrama generally, after walking long time, legs will start paining. So even for that kind of leg pain also, you can use this combination of medicines. So if you prepare this formula and keep it at home, it will be handy for so many different situations. So when you are doing parikrama, it will help. Now we had this Japa retreat recently in Govardhan, and devotees went for Govardhan parikrama also. And so many people were having lot of leg pain. So they got good relief after just 2 or 3 doses of this painkiller combination of these painkiller medicines. So those 4 or 5, you need not mix all these medicines. As I said, only hypericum or medicine number 2, 3, or even 1 you can include. The first 5, if you include, usually it will be sufficient for most of the pains. So you can use it as a general painkiller also. So after Govardhan Parikrama or Padayatra and all, you can do these things. You can use this. And I will tell you one interesting situation, rather I will tell you one very, one more case study, that one Mataji in Govardhan Parikaram was hit by a bull. So her back was pierced by the bull horn. And then she had a very big contusion, a very big swelling, and that whole area became black and purple in color. A black patch was formed, and it was very painful. So after taking 3 doses of that this painkiller combination, she felt relief. And after about 2 days, the size of that contusion was significantly reduced, and her black patch was also significantly reduced in size. So another example, actually, just 3 weeks back, my mother slipped and fell down at home, and then she fell on her left side, and full left side was paining, and then there was a big black patch in the eye. I mean, around the eye, that black and blue. It is like when you are practicing boxing match, somebody boxes on your eye, you get that blue and black eye. It was that bad. So after 3 days of using this, 3 or 4 days of using this combination, that black patch was reduced to half. And then after about 7 or 8 days, that black patch was completely gone. And after that, people who came to visit her, on first day they saw that black patch, they were shocked. And after a few days, after 1 week, they're coming, they're seeing it is gone. They could not believe it. So, arnica, the third one in this slide which I'm showing you, it works like magic for this kind of black and blue patches due to internal injuries. So because it improves the blood circulation all over the body, due to the improved blood circulation, those black and blue patches will go away quickly. Those purple patches will go away very quickly. So now sometimes during an injury, there can be septic condition also. Some pus may get formed. So in that, there is one more medicine mentioned there, heparin sulfur, for removal of, cleaning up and removal of pus. And then there is a homeopathic cream called calendula, which you can also use for external wound. Like in the previous slide, I said you have Shatadota Kritam, the Ayurvedic medicine, the last one for burn and scar. Shatadota Kritam you can use for external injury also. Another alternative is calendula, the third last medicine. You can use it for external wounds. You can apply it either in the cream form or in liquid form or for external wound. And the calendula, you can take it as an internal medicine also to help in speeding up the external. So if you are having external injury, you can apply calendula externally, and additionally internally also you can take it as a medicine. It will help in healing the wound more quickly. So in your combination, if you have external injury, you can include calendula also in your formula. So generally, the homeopathic doctors, they will ask you what is your problem, and based on that, they prepare this formula and then give it in the form of sugar pills. So now you can do it. If you know this, you can do it yourself at home, because this could be emergency situation and you may not have time to go to a doctor, or sometimes the doctor may not be available. So these things, it is good if you keep it at home. And another situation can be, suppose when children are playing, they tend to fall down frequently, and they tend to get fracture, or they may tend to get some injuries. So for children also, if you have children who are playing and who have a tendency to fall down frequently, then also this combination of medicines will be useful. And generally, when you have any other kind of pain, so let's say old people, they have this tendency to fall. I mean, they may have this instability. They may have a tendency to fall. Suppose they develop a fracture or something. Again, you can use this symphytum, and then in this slide, I think it is the fifth medicine, symphytum. And in the previous slide, I mentioned Lakshadi Guglu. So those things you can, when you are having old people at home, it is better to keep symphytum and Lakshadi Guglu at home, because anytime they might fall and get a fracture, and they might get a fracture also. So you can start this medicine. So actually, my father once had a fall, and actually in the lower back, the spot was paining severely. So, and he was 82 years old. So then the doctors told, after seeing the X-ray, they told, first of all, he's very old, and secondly, lower back means there will always be strain in that area, whether he's sitting or standing or whatever. And you cannot apply putty, that plaster also in that area. So the doctor said nothing can be done. You can, maybe we can try some bone surgery or something, but they were also afraid to do that because age is very old. So, but then what I did, I gave him this combination, and additionally I gave him extra dose of Symphytum. So within 2 days, his pain was significantly reduced, and after about 2 weeks or so, 2 weeks he saw very good amount of relief, and in the third week the fracture was complete. So, now now this knowledge is generally the cure for fear. So generally in such kind of situations, even though the doctors were afraid after seeing the surgery, we were calm because we know that such options are there. So we can do these things safely at home without side effect. And also it is good to take a calcium supplement if there is a fracture. Now again, instead of taking calcium tablets like Telcal, there also there is a problem that sometimes if the calcium tablet is not properly digested, so that calcium might get deposited somewhere else like kidney and all, it might cause kidney stone or something like that. So long-term use of those calcium tablets is also not very good. So fortunately in homeopathy, there are calcium supplements which don't have any side effects, which are totally safe and which will give the same kind of result also. So there is calcium phosphate in homeopathic calcarea phos. You will get it in any homeopathic shop, and there is a homeopathic supplement called HomeoCal, which again you will get it in any homeopathic shop. So you can combine these medicines along with calcium supplement. Once you take an X-ray and come to know that it is a fracture, then you can add a calcium supplement also. And this Symphytum, which I mentioned in this slide, you can use it for old people for generally strengthening their bones also, so that even if they fall, they will not get a fracture so easily. Because in old age, generally the bones will become little brittle, and especially for women, it will become more brittle also after menopause and all. So this Symphytum and homeopathic calcium supplements are very good for. I have to speak louder.
No, correct.
Oh, okay. Sorry, which tonic? Ashwagandha. Yeah, somebody is asking about ashwagandha. Yes, ashwagandha is also a very good Ayurvedic remedy for these kind of problems. So ashwagandha is generally very good for the muscles and tendons repair. But ashwagandha you can take as an additional supplement. Ashwagandha alone will not be sufficient. So the main medicines will be what I mentioned here. Gublu. Yes. So ashwagandha along with gublu you can take. But along with ashwagandha, it is better to take these things also. So yes, ashwagandha will also help for strengthening the muscles and repairing the muscles and tendons quickly. So yeah, what was I saying that? So when you have all these injuries and contusions, for old people, if you are taking this, their bones will be brittle, so you can give them Symphytum not every day. If it is for preventive purpose, you can just give them twice in a week. Symphytum, it is sufficient. Otherwise, if it is a fracture, then you will have to give it multiple. If the fracture has already happened, you will have to give them multiple times a day. So, Parkinson's we discussed. No, for Ashtanga Yoga, you will have to consult some yoga instructor for that. We are yoga posters, we are not covering today. Okay, so now for this bones, we use Symphytum. Okay, somebody is asking, is tuna or limestone a good source for calcium? Yes, you can eat tuna also. Yes, that is also a good remedy. Yes. Yeah, thank you for that. That is also a good idea. You can take tuna also. That is lime. Okay. Finally now another kind of ache. So this kind of painkiller combination you can use for many of the pains, and depending on the situation you can decide which of these medicines also to use. You can use these combinations for headache also, it will help, and for any kind of general body pain also it will help. It will help by improving the blood circulation and also by repairing the muscles and joints that due to the injuries.
My mother is suffering from body pain last 1 week. She
Mm.
is suffering from low BP also.
Mm,
She
mm.
is on tablet also.
Mm.
Even night time they are taking a dose of 360.
Mm.
650 tablet they are
Mm.
for body pain. Can I use?
Okay, for body pain you are asking whether you can use this. Yes, you can use these combinations. But there is another very good remedy. Okay, one devotee was asking here. Yeah, I'll repeat the question for the people who are in Zoom. So somebody here is saying his mother is having body pain and low BP, so can she use this? Yes, she can definitely use these things. And in addition, if for such body pains, it is very good if you can use heat packs. So this general body pain is usually due to kapha. So these dull body pains, heat packs are very good. You will get heat packs in any medical shop. Whichever area is paining, you can apply heat packs in that area. You will get good pain relief. And if you have the patience, you can alternate between heat and cold packs. That is even better. Because when you apply heat pack, the blood vessel will expand. When you apply cold pack, it will contract. So this constant expansion and contraction will improve the blood circulation all over the body. So that is also a good idea.
Some gel is available, packed gel. You can keep it in fridge, you can keep it in hot water.
Yes,
Gel packs are-
yes. Here, Murari Prabhu is telling that there is also a very good one kind of a gel pack that is available in medical shops. You can apply. You can use the same gel. You can keep it in. You can heat it up and use it as a hot pack. You can keep it in fridge and use it as a cold pack. So when you are using alternate heat and cold packs, then you have to make sure that the duration of the heat pack should be more than the duration of the cold pack. So let us say you keep heat pack for 10 minutes, then cold pack only for 2 minutes. Then heat pack for 10 minutes, it should be like that. Now, the same pack, if you heat and then cold, then you put it cold, it will take more time. So to save time, you can keep 2 packs. One you keep heating and use as heat pack. The other you can keep it in fridge and use it as cold pack. So that is also a good idea in such situations. Yeah, for entire body you can use it. Yeah, the one devotee is asking. You can use it for entire body. Otherwise, another good idea I will tell you, that if you have this bathtub in the bathroom, then you can heat up some water up to 42 or 43 degrees and then lie down in the tub, immerse yourself in the tub up to the neck. So the entire body will get the heat therapy and it will enjoy also. It is very relaxing, it will reduce your stress and it will reduce your pain also. It will expand the blood vessels in the body and the blood flow will improve. See, generally these pains are generally caused by lack of proper blood flow. So like one devotee is telling his mother is having body pain and low BP. So that clearly shows that the blood circulation is insufficient in the body. So
We don't have a tub for using this one. Is there an alternative?
Hot water.
yeah, okay. Another alternative is hot water bath. So hot water bath also helps generally for pains. But of course, hot water bath, the duration will be short. So for longer duration, you can use these heat and cold bags and hot water tub. Or at least, if you cannot apply it all over the body, at least for the legs, you can immerse in hot water. That is another alternative.
Or any cold means setup like that.
Hmm. Hmm. Sorry?
Any coat is there, instead of the tub, no?
Hmm.
You can use any coat, means
No,
like
blanket.
blanket,
He's asking.
For heat.
yeah.
But okay, somebody is asking whether you can use blankets for heat. So that blanket heat may not be sufficient. Usually for this pains and all, you require more heat to improve the blood circulation.
Electric heat is also coming. There is a wrapping cloth type with the electric
So you
plug.
can use electric heater. There is
It comes with a bag only.
in medical shops you get.
Steam will give that.
Huh?
Not steam. Bag only, you can wrap it and do electric switch on.
So yeah, there are electric heaters also.
Like bag type it will be there. You can wrap it. Flexi. Like a cloth type it will be there. You wrap it and turn on. Whichever parts you can wrap. You belt it. You have that back pain belt, you know. You can tell like that it will be there. Back support belt type.
Supplement came on after 1 week, my leg up.
Sorry.
Complete that no part of thing.
Okay, if if the heat there is sufficient, then you can use that also. So ultimately you have to apply heat. Okay, so there is one question here. One Mataji is asking that you have knock knees after parikrama, knees are paining, but cold pack is reducing the pain. So now there are cases where now when to use heat and cold pack. Generally, when there is an internal inflammation, then cold pack will help. So, if you are having, if cold pack is giving you relief, that means there was an internal inflammation.
Vibration we can use. Vibrator, small equipment.
You can now, okay, one more question one devotee is asking is, can we use vibrator? Yes, you can use vibrator also, because vibrator also improves the blood circulation.
I have used it for long.
Yes. Yeah, and sometimes during in the parikrama mark, they will, some people will have these vibrators in roads, in some stalls. So that vibrator also, it will improve the blood circulation and give some pain relief. Okay, so coming to this question in Zoom chat, if you are getting relief from cold pack, that means you are having internal inflammation. So in internal inflammation, cold pack will give relief. But even in this case, it is better to alternate between hot and cold pack, because the blood vessel will expand and contract, and it will improve the blood circulation and it will heal the problem little faster. So alternate hot and cold pack you can still use. Additionally, you can use this Ayurvedic and homeopathic remedies. Externally, you can apply Murivanna oil, and internally you can take these homeopathic medicines and Lakshadip.
She is using 3 years for the daily 3 or 4 times.
Mm-hmm.
My mother,
Mm-hmm.
low BP, everything is there. Even though she is not here.
So no, low BP will discuss later. Yeah, we'll come to that later. Yeah. Okay. So yes, is there a way to cure knock knees generally? So these remedies which I'm telling here, it is for the time being. But if you are having a chronic problem, if it is coming repeatedly, then it is usually a combination of a Vata and Pitta problem. So in that case, you have to take steps to balance your Vata and Pitta. You will have to use some kind of Ayurvedic oil in that for external application, and also take some internal medicines for balancing your Vata and Pitta. So again, Gomutra Ark is a very good Ayurvedic remedy for these kind of pains and problems for long term, not for short term, but for long term. So you can take Gomutra Ark with the Kanchanar in it. So, and there is also one Ark called Arthorit. If you go to a website called gaurashtra.com, there is a website. There is also a product called Arthorit, which helps with all kinds of knee pains. So that is something which you can take. And additionally, externally, you can apply some home. You can apply externally. You can apply Muribenna for the time being, and for long term, you can apply some pain relief oils that are available in Ayurveda.
Is there any medicine to improve the memory?
Medicine to
Why there
improve.
are some medicine for the long term?
No, for memory, it is genus, yeah. What we discussed, genus. Okay. So okay then. So this pain management, is it somewhat clear now? Some idea you are having? Okay, there are still 2 more types of pains which I have yet to explain. Okay, yeah, thank you, ma'am. Anybody else has any questions or anything? Okay, now what about toothache? So toothache is generally something which is very, very severe. Sometimes these whatever medicines I told you sometime back, that also may not be sufficient for toothache. So for toothache, there is a special combination that I have given second last in the slide: Plantago, Belladonna, and Calendula. These 3 mother tinctures, you get it in any homeopathic shop. You mix it if you are a dental patient. If you are having some tooth pain frequently, you keep this at home, and then you gargle this 20 drops of this mixture in some warm water. If you gargle, then in less than a minute you will get pain relief. So you don't have to take. So if you are going for some tooth extraction or root canal or something like that. So there will be a lot of pain, and let us say even before that your tooth has become very sensitive and it is paining. Then this combination you can use for gargling, not for internal taking, for gargling. And these other medicines you can take it internally. So now my mother recently had a tooth extraction. So then the doctor gave some painkiller, but we managed with this gargle with this combination. So we avoided the painkiller completely. We just took this formula, this plant type of belladonna and calendula. I made a mixture and gave. So this is a very good combination for toothache. And another serious kind of injury is eye injury. So you suppose you fall down on your face, and suppose there is some injury to the eye, and around the eye it is all black and blue, and inside the eye also suppose it is reddish and there is some slight bleeding. Suppose your eye has got injured, then then the two most important medicines are arnica and ruta. The last medicine in the slide, ruta graveolens. It is you take it 2 or 3 drops every 1 hour or so after you get the eye injury, and after a few hours you can reduce the frequency. You can make it 2 or 3 times in a day. Then you have to take arnica also. Any kind of injury, arnica is a must because it is going to improve the blood circulation. So eye injury, arnica plus ruta you can take. And symphytum is also good for eye repair, any kind of eye injury. The 5th medicine. It is useful for bone repair as well as eye injury. Now, depending on the situation, you can decide which of these medicines to use. Sometimes you can keep changing. Yeah, if there is a fracture or eye injury, you use symphytum. Otherwise, it's not required. If there is a swelling, you add belladonna, which is the first medicine. And if there is any kind of muscle strain involved, you put the 4th medicine first off. And if there is any nerve damage, you use the 2nd medicine. So now in my mother's case, there was also some pus formation in the tooth due to some tooth infection. So then I gave her Hepersulf also, which is useful for pus formation, and there was inflammation in the gums, so I gave her belladonna. So whatever problems are there, you can select those medicines, make a combination, and then give it to the people. So additionally, after the tooth extraction, there will be some kind of injury there, because tooth extraction is some kind of surgery. So after tooth extraction, there will be some injury in that place. So for these kind of injuries, the arnica and calendula are very good. So then what I did, I made a combination of arnica, calendula, belladonna, because there was some inflammation there, and Hepersulf to avoid infection. So I did not include Rustox, I did not include symphytum. So without painkiller, we were able to manage after the tooth extraction. So now another thing, suppose you go to the hospital and you have a surgery. Now surgery is also another kind of injury where they will tear open some part of the body, then they will do the surgery, and then again they will apply stitches and then fix it. So after surgery also, generally the body it has undergone some injury. So surgery is also considered as an injury to the body. So if you want to quickly recover from surgery also, you take arnica and hypericum and Rustox. So it will quickly repair the surgical wounds also. And you take calendula because it is an external wound also, because externally they are cutting open the skin to do some surgery now. So calendula is useful for external surgery. So you make a combination of all these 3-4 medicines, and then you can take it. You will quickly recover from surgeries also. Of course, ideally we hope that nobody will need a surgery. That's what we are hoping. But if at all you have to go for a surgery and you want to quickly recover, because surgery means you have to take leave from work, at least for 2-3 weeks and all. So after surgery also, everybody wants to recover fast and get back to their seva or get back to their work quickly. So these medicines will help you in quickly recovering from surgery also, surgical recovery. Okay, any questions on this? I hope it was not very technical. I hope people understood.
Continue.
Okay, yeah. Any questions or is it clear?
Next topic.
This book.
Next topic.
Uh-huh.
Yes. Sound 45.
Okay. What time you are going to?
750.
12:50. Okay.
Careful.
Yeah, Hare Krishna.
Due to that, she's getting a hard pain from past 6 years. So, which are the medicines you can suggest for her, Prabhu?
No, sorry, actually there was some echo. So can you repeat it again? Your mother is facing gastric problem. Then.
Gastric problem. Due to that, she's getting hard pain. Like chest pain.
Oh, okay.
The past 6 to 7 years, she's facing this problem.
Okay. She is having gas problems. So is she also having bloating and all that? And is the pain also moving here and there?
You are the host.
Okay, but no bloating at all. Only gas.
Change. Then you change.
Mm-hmm.
Yeah. This
Oh.
started only for the laptop. You write clearly correctly. Then you take it in this mobile.
Okay, if she takes up more work, she gets chest pain. Okay, so now see if you are sure that it is a gas problem. So generally for gas problem, nux vomica. If the pain is due to gas, actually I did not. I think I forgot to include that in this list. So now good that you mentioned it. I'll add it to this list. If the pain is due to gas, then you have to use a medicine called nux vomica. NUX VOMICA. So I will add it to this list. So she has to use nux vomica. 3 drops she can directly take in a time, maybe 3 or 4 times in a day, depending on how severe the problem is. This is for pain that is related to gas. But in addition, if there is any pain in any particular area, she can do some warm oil massage on that area. That warm mustard oil, it can be applied to any area which is having that, which is affected due to that gas pain. Now, if you are saying that because of muscle strain, if she is straining too much in work and then some areas in her body are paining because of that, if it is due to strain, then she can take arnica plus Rustox, the third plus fourth medicine. Rustox. In the list, in the slide that you are seeing, no, the third and fourth medicine. Because Rustox is for straining, spraining. So if due to overstrain, if it is paining, then Rustox is the medicine. And arnica, generally for any kind of pain, you must take it because it will improve the blood circulation. Only for gastric trouble, arnica will not be useful. For all other kinds of pains, arnica is useful. So for gas pain, she will have to take nux vomica. What I will do is I will just type it in Zoom chat now because it is not there in the slide. Just give me 1 minute and type it in the Zoom chat. No, homeopathic shops. Okay, nux vomica. So this is available in any homeopathic shop. So these medicines that I have listed here, they are available in their homeopathic medicines. You will not get it in a medical shop, you will get it in a homeopathic shop. And the medicines that I mentioned in my previous slide, you will get it in Ayurvedic shop. So here we are giving some alternatives for allopathic medicine. So that, because allopathic painkillers generally have side effects and they are generally not very healthy. They are not, generally they are not good for the long term. So we are just giving other alternatives.
Ayurvedic medicines are good or no? Medicines would get any side effects in case of these medicines or anything like this?
No, absolutely no. There is no side effect at all. That is the reason we are suggesting these medicines. In fact, I will tell you that my father's case, he had a fracture and he was having severe pain. So I was giving him Synphytum plus Rustox plus Arnica almost every 15 minutes for the first 3 hours. And after that, once in 45 minutes, I was giving these medicines. So in 2 days, the pain significantly reduced. So the one good thing about homeopathy is that you can take frequent doses every 15 minutes or every 20 minutes, every half an hour, if the problem is very severe and you want quick relief. So now if the fact that you can take it every 15 or 20 minutes means that it is not having side effects. Otherwise, allopathic medicines, you cannot do that. Even with Ayurvedic medicine, you cannot do that. You can't take it so frequently. So if the problem is very severe and you want quick relief, then this is a very good idea of taking frequent doses. Now somebody may ask, okay, instead of taking that medicine every half an hour, why can't I just take one big dose at one shot? That will be easier. That may look easier, but actually that will not have much effect. Generally, in homeopathy, if you want quicker results, it is better to increase the frequency of the dosage rather than increasing the quantity of the dosage. So instead of taking more number of drops of the same medicine, you increase the frequency of the medicine. Take it more frequently, and you will get quick relief without any side effects. So then what you can do is, it is not that because fracture, that too for old people, it results in very severe pain. So I had to give so many doses. Otherwise, if it is a younger person or if it is the pain is less severe, then you can just give a frequent dose for one or 2 hours. You can give it every 15 minutes or every half an hour. And after that, you can start reducing the frequency as the pain improves. As the person starts getting relief, you can reduce the frequency to once in 2 hours, and then make it once in 4 hours, and then ultimately you can make it just 3 or 4 times in a day. That will be sufficient. And as the pain reduces, you can gradually stop the pain. So this way you can do. So this is the way to take homeopathic medicines in case of emergencies or in case of sudden acute issues. And Ayurvedic medicine, usually it will be 2 or 3 times a day. Of course, if it is external application, you can just keep applying it. If it is internal consumption, you cannot take it generally, you can't take it more than 2 or 3 times a day. 3 times is also okay. So in the previous slide, I mentioned Lakshadi Guru. I can come back to this previous slide. Bone and muscle healing. You can take 2 tablets twice a day or even thrice a day is okay after work. And Maharadin Prasnadi Kashayam also, you can take it 3 times a day also. So that will also help you with the pain. So what you can do is that you can take a few doses of the homeopathic medicine, get some relief, and then take one Ayurvedic medicine. Now another question people may ask is, can we take homeopathy and Ayurveda at the same time? The answer is that you can take it as long as you leave half an hour gap between both the medicines. The only thing is you should not take homeopathy and Ayurveda together. Mix them together and take. That is the only thing you should not do. If you give half an hour gap, then both of them will happen. Okay, thank you for that question, Mataji. So any other important or relevant question like this somebody wants to ask related to pain?
I have another question. For women, we have problems, right? Like white PCR. For that,
That actually we will be discussing tomorrow, Mataji. Tomorrow is the session exclusively for Mataji, exclusively for women's health. So that is the reason today, of course, now when we are talking about pain, there will be pain related to pregnancy also, there will be pain related to menstrual bleeding also. So those kind of pains I am not covering today, because tomorrow is exclusively for Matajis, for women's health. So all these women's problems, the gynecological problems, and pain due to gynecological issues and pregnancy issues and lactation related pains, we will be discussing tomorrow. Okay. Yeah, any other question related to what we discussed today? Okay then, so we'll go on now. So we talked about pain and injury management. Then next is fits and epilepsy. So this is actually a Vata imbalance. So if you remember that Vata, Pitta, Kapha, what we discussed that day, okay, I think the slide I have to adjust it a little bit. Just give me 1 minute. Okay, in the meanwhile, now fits and epilepsy. If you remember, any kind of disease which is related to the movement of the body, That is generally a Vata related problem. So now fits and epilepsy is a situation where somebody is moving, somebody they lose control over their hands and legs, and then their hands and legs will start shaking violently. If you see somebody who is having fits, it will be like that. So it is a Vata related imbalance. So now what to do if somebody gets suddenly gets fits or epilepsy? I will just open the slide now and show it to you. Okay, so first of all, it is a Vata imbalance. So what you can do in such a case is that you avoid, first of all, you avoid cold items, cold water, dry items like bakery products or biscuits or bread or all these things, because any dry item will make the Vata problem worse. It will aggravate this kind of problem. So avoid cold items. You do oil massage and drinking warm water generally will be helpful. But now if that person is violently shaking with fits, at that time he'll find it difficult to drink that warm water also. So in that case, one home remedy is 2 drops of tulsi juice or onion juice in the nose. Now why is this? Okay, one question somebody is asking, Naxvamika and Rustox. Okay, Mataji, for your case, Naxvamika is for gas problem. I mean, I'll just go back to that earlier question. I think it is related to the pain. So Naxvamika is for the pain related to gas, and Rustox plus Arnica is for the pain related to strain. If your mother is straining and then she is getting a pain because of the overstrain, then it is Rustox plus Arnica. Rustox is for strain and Arnica is required because it will improve the blood circulation. So it is Naxvamika, Rustox and Arnica. Okay. Yes, this is for Ramya Mataji's question. Okay, so now coming back to this fits and epilepsy, 2 drops of tulsi juice or onion juice in the nose. So now generally this, of course, as devotees, we may not be having onion at home. So in this case, you will have to give. There is a homeopathic equivalent, something similar in homeopathy called allium cepa. I will just put it in the Zoom chat. So this is a homeopathic equivalent of something which is, you can say similar to onion. So this you cannot put it in the nose. This you'll have to give that person orally. So this you can do. And in Ayurveda, generally ghee nasya is very good for fits and epilepsy. If the person is violently shaking with his hands and legs and all, then you have to. I think ghee nasya. I don't remember if I explained the procedure earlier. I think I explained that you have to warm up the ghee and then you have to lie down and put 3 drops of each nostril. Now, if that person is shaking violently, that means he will, again, using ghee nasya will become a little difficult, because when he is shaking his head, see, when you are using ghee nasya, we should not shake the body, you should lie down still. So in this case of fits and epilepsy, that person cannot be still, his hands and legs will be still shaking. So ghee nasya you can use only after he stabilizes. For preventing further attacks of fits and epilepsy, you can use ghee nasya. But in the meanwhile, while he is having the fits and epilepsy, you want to put a stop to it. Then there is a homeopathic medicine called Buforana. So 2 drops 3 times a day. 3 times a day is a general schedule, general dosage. But if the fits problem is very severe, you can open his mouth and put 2 drops into his tongue. Like that, you can put it every 15-20 minutes till the fits will subside. And then there is one mineral salt called Kaliphos, that is potassium phosphate, which is also available in homeopathic shops. It is homeopathically diluted and totally safe. It is a wonderful brain and nerve tonic. And this Kaliphos that I mentioned in the bottom of the slide, it is an excellent medicine for any kind of brain disease like Parkinson's or Alzheimer's or dementia. Also, it is a very good brain and nerve tonic. So this fits and epilepsy, it is related to brain and nerves. So if you take this Kaliphos also, 6x potency, you can take it 4 tablets, you can put it into the mouth, you can take it 3 times a day. This is on a regular basis, but suppose for emergency, if you want some quick results, then you can take this also frequently. You can alternate between Kalifas and Buforana. 10 minutes later Kalifas, then 10 minutes later Buforana. Like that, you put a few doses. Then, even you don't have to do it for the whole day. If you usually do it 3 or 4 times, then within 1 hour the fits, within less than 1 hour the fits will reduce. And after that, after the person stabilizes, then you can reduce the frequency of these medicines. Then instead of giving it every 20 minutes, you can just give it every 1.5 hours. And in the meanwhile, you can give Ginasya. So Ginasya will stabilize the brain quickly, so that he will not get further attacks of fits and epilepsy. So this fits and epilepsy, is it clear? Yeah. So now in these kinds of sudden acute emergency situations, there will be 3 or 4 remedies. We should know which one to do first. As I mentioned, as somebody correctly told, in heart attack, it is better to put the ginger in the mouth first. Because if you have to heat up the water for hot water immersion, that is going to take more time. So in the meanwhile, you can chew the ginger. So similarly, in this case, Ginasya you cannot put immediately because the person will be shaking violently. So first you put Buforana and Kalifas, then into his mouth somehow. And then later on you can give Ginasya. So stroke and paralysis, this is a little more serious. Anything that can aggravate Vata. Against paralysis is a Vata related problem. So paralysis means I'm not able to move the hand or move some part of my body. So we discussed 2 classes earlier, that 2 days back, that any movement related disorder is because of Vata. So paralysis and stroke is also, which paralysis is a Vata related problem, and paralysis is very often caused by stroke. So in stroke, what will happen is that any direct sunstroke, for example, when there is a lot of heat in the head, the sun falls on the head, then some blood vessel inside the brain will burst, and then because of that, some part of the brain will not get blood. So because of that, you may get paralysis. So how to handle this stroke and paralysis? So warm water and oil massage will be helpful for stroke and paralysis. Additionally, this chewing ginger. Now remember, sometime back we were talking about chewing ginger for heart attack. The same chewing ginger remedy will work for paralysis also. Because paralysis is also a Vata problem, similar kind of problem. You take a lot of ginger and put it into the mouth, then the Vata will reduce, and then the paralysis condition will improve. The person will start moving his hand a little bit. And you have to put a cold towel on the head. Why? Because stroke is because of too much heat in the head. Too much heat in the head means some blood vessel in the head will burst, and due to which you are getting some internal clot and stroke. So, in fact, the first thing you should do is that you should put heat in the head. You should put cold towel on the head. That is more important than chewing ginger. Because chewing ginger, paralysis, even after half an hour, if you give him ginger, it is okay. Because paralysis is not life-threatening after all. So paralysis, even after 15-20, heart attack is life-threatening. So immediately you have to put ginger into the mouth if you are getting chest pain. But paralysis, even if you take the ginger after 10-15 minutes, it is okay. But first thing is that you have to put cold towel on the head to reduce the heat in the head, so that the person will not get a stroke again. See, he might have already got a stroke once, due to which he got paralysis. Now if he gets another stroke, then the paralysis can become more severe. So for that, first thing is put cold towel on the head so that you reduce the heat in the head. Then you take the ginger, and then you put lower leg hot water immersion. Then you can immerse the leg in hot water. Because anyway, hot water, to heat up the water, it will take at least 5-10 minutes. So that you can do a little later also. So, among all these 3-4 remedies, important thing to know is which remedy to use first. So if it is because heart attack was life-threatening, ginger was first. Now in this case, the stroke is more threatening than the paralysis, because stroke will make the paralysis even more severe. So first you have to control the stroke by putting the towel, cold towel on the head. And for stroke, another wonderful remedy is Ginasya. So Ginasya, again, but then for Ginasya, again you have to make the person lie down. You have to heat up the ghee. I told you 2 days back. That will again take a few minutes. So again, we don't even want to waste a few minutes. So Ginasya also you can do later. First thing is you dip a towel in water and put it on the person's head, so that he will not get further stroke problem. Then you can take Ginasya, you can heat it up and put it in the nose. And parallelly he can chew ginger also. And after you, while he is having the ginger in the mouth, you can put ghee in the nose, so that you can do it parallelly. And then after some time, you can use this arnica. Arnica in 1 million potency, very high potency of arnica every 10 minutes. Now why arnica? Because in the previous slide when we were talking about pain management, I said arnica is an excellent homeopathic medicine for improving blood circulation. So now you have to improve the blood circulation in the brain somehow. And arnica is very good for clearing up the clots. If there is any clot, blood clot in the brain, internal clot, and internal bleeding or internal injury, arnica is very good for clearing up the internal clots in the brain. So start giving that person arnica. For emergency condition, you can give it every 10 minutes for maybe 1 hour or so. And after that, you can give it 2-3 times in a day for the next 2 days. And additionally, for gloronium is a special medicine in homeopathy for stroke. Then later on, now after you have given all this emergency treatment, the person, he will lose control over his hands and legs. Now his hands may be either his hands will be paralyzed or his hands may be shaking violently or something like that. So
stiff also.
yeah, sometimes it will be stiff also. Either it could be stiff or it could be shaking violently. Some kind of movement instability will be there. So for those things, SBL 5-phos tonic. This is a homeopathic tonic where the 5 phosphates, potassium, sodium and calcium, all these kind of phosphates. These generally phosphate salts are very good for building up the body tissues. Generally all this kind of paralysis and stroke, it will lead to weakness, and even Parkinson's, it involves a lot of weakness. So this tonic, it will strengthen up all the tissues of the body, especially the nerves and the brain, so that the brain can handle these issues more effectively. So now let us say suppose that person doesn't have a paralysis, but he just has a stroke. Now that is also possible. So sometimes stroke without paralysis, the body will keep shaking violently. The hands and legs will just be shaking, and you will not be able to hold anything in the hand. It will, the trembling will be very severe. Sometimes stroke can lead to this situation also. Sometimes even Parkinson's disease leads to this situation, but stroke can also lead to this situation. So if you are seeing that there is no paralysis, but there is a violent shaking of the hands and legs, then you can use this SBL 5-phos tonic. So this, in my father's case, I gave it once every 20 minutes for 2 hours, and in 2 hours he became stable. And after that I started giving it to him 3 times a day.
What is the vitamin name?
SBL 5-phos tonic. So it is all these things I will document. So you don't have to worry about taking down these medicine names. I will make all these things into a document and I will circulate it to Murari Bhakta Prabhu, and he will circulate it to everyone. So you will get all these names. Don't worry about that. So here we will focus more on the concept. And of course we will, the mineral salt which is there in the slide on the last item is Kali-phos. That is again potassium phosphate. It is a very good brain and nerve tonic. So again, this stroke and paralysis, it is affecting the brain and nerves. So Kali-phos again is very useful. Now see, again the purpose of all this seminar, it is not to give you a list of medicine names. Rather it is to give you confidence and to explain the concepts behind all these things, so that you get you understand how the system works, and so that you will be more calm and peaceful next time. And even if some situation comes, we need not panic. Because if we panic, then our brain will get paralyzed. We cannot think clearly, and then we won't know what to do, and then we might end up doing something wrong also. So important thing is to be calm and not to panic. So all this knowledge is just to give us more confidence, so that we can be calm and accordingly take the relevant steps. So this, why we are explaining this concept, because generally doctors, homeopathic or Ayurvedic doctors, they don't have time to explain all these concepts. They will only give the prescription, the medicines, because they have a lot of patients to see every day, and they cannot explain these things again and again to everyone. So they have time limitations. So that is the reason we are organizing these sessions, so that everybody is aware of all these things. So it is just to show that we've got so many options here. Okay, so any questions on this before we proceed further? Okay, so then, yeah. So sudden breathlessness. This is something which is very important. because last time if you remember, during during COVID time, so many people faced this breathlessness, and then they started panicking, and so many people were ordering oxygen cylinders, and then the hospitals were running out of oxygen cylinders, and because people were panicking, the breathlessness becomes even worse. Generally, see, one problem leads to the other. So generally when you have a little breathlessness, then you get a little tensed that okay, what is going wrong? And because you get tensed, the breathlessness will become even more. And one thing will lead to the other, and then ultimately, unfortunately, we'll end up in hospital after that. So now we want to avoid that kind of a situation by understanding uh, how these remedies work. So now for bloodlessness, first home remedy is you sniff desi kapoor. Now this sounds so simple. This desi kapoor, that is, it has to be that the original traditional variety of kapoor. You will get it in Google also. Even if you can order it online in Amazon. If you Google for desi kapoor, you will get it in so many websites. You can keep it at home and you can just sniff that kapoor, that camphor. So you can just sniff that camphor. So you will get some quick relief from this breathlessness. Then you have this go basma, that is cow dung ash. So from this pure desi cow dung, you just put one pinch of it in 1 liter of water, and then you drink that water slowly. So that will quickly generate oxygen in your body, and then your breathlessness will come down. And in homeopathy, there is a medicine called aspidosperma, which is most common. So now I remember in our retreats when I was actually taking care of this medical seva of giving medicines to sick people. Then one devotee suddenly developed this breathlessness problem, and he could not breathe initially for a few hours. He could not sleep in the night. So next day morning he came and told me. Then what I did was I gave him this aspidosperma because that is what I had at that time. So then I told him to take 15 drops of it in a little warm water in the night, and if he gets that breathlessness attack, he should take it every 15 minutes. So he took it every 15 minutes, 3 or 4 times, and immediately he was able to breathe properly. His breathlessness went away. So before that he was panicking, but after I gave him this medicine, now he's calm and he's happy. Now another alternative is cow dung ash. So cow dung ash produces a lot of oxygen when you mix it with water and drink. So this is also very useful for asthma patients and for sudden breathlessness. And even I know some devotees who go on yatra to high altitudes like Badrinath or some very high altitude place where the oxygen is less. So when they face the breathlessness problem, they usually take this cow dung ash mixed with water and then they drink it. So this is a good remedy. And aspidosperma is also another good remedy.
You get a pale face. Face change to pale. Breathlessness, face color change. Is it vata or pitta?
Okay. One devotee is asking that generally during breathlessness the face becomes pale. Is that because of vata, pitta, kapha? That is actually because of vata. Because when you are not able to breathe properly, the body is not getting enough oxygen. So the blood circulation is not happening properly in these areas, in the face areas. And when this blood circulation is, blood circulation means the blood is not moving properly. So it is a movement related disorder. So it is a vata. So generally, so now when you are having this kind of breathlessness problem, the important thing is, and you are having this, the face is becoming very pale and it is becoming colored. Now some people make the mistake of splashing water on the face. Don't do that. Because vata, it gets aggravated when you use something cold. Because water is cold, if you splash cold water, it may get worse also. So don't splash water. Instead, you drink water with this gobas. You put this cow dung ash in water and drink it. Or you can take this homeopathic medicine water and drink it, and you can sniff this camphor. Camphor you can keep sniffing.
Sequence, what are the sequence? Such emergency, it's a critical.
Okay, so yes, one devotee is asking now, what about the sequence? Now, can anybody suggest in what sequence we should do these things?
For any disease in Ayurvedic or homeopathy, there is no injections?
I don't know. Maybe there could be some injections. We have to see. I am not aware of.
From tablet and the planning only on border except injection.
Okay, okay. One devotee is asking, are there any injections in Ayurveda and homeopathy? I said, I am not aware. Maybe there is something we have to ask some practitioners, some doctor. Okay, so anybody wants to guess what sequence we should use like this? So whether we should use Desi Kapoor first or Go Basma first. So if you have Desi Kapoor at home, it is good to sniff the Kapoor first, because now for this aspidosperma, if you have to take this, you have to mix it with water. Somebody has to find out where the medicine is, mix it with water, and it is preferable that if the water is warm. Otherwise, for emergency, you can use normal water also, but warm water is little preferable. So that may take a little bit of time. So in the meanwhile, you can stick the Desi Kapoor, and finally when the aspidosperma medicine is ready, or this Go Basma, the cow dung ash is ready mixed with water, then you can drink it. And then this homeopathic medicine, you can take it every 10 or 15 minutes. So after taking one dose of this homeopathic medicine, then you can keep sniffing the Kapoor, the camphor. Because 10 minutes also we don't want to waste. So after taking one dose of aspidosperma, you sniff this Desi Kapoor, and after 15 minutes another dose of aspidosperma, then again come back to Desi Kapoor. Like that you can do. So first to start with whichever one is more easily available. If Kapoor is easily available in shelf, you take that first. Or if maybe Kapoor, you don't know where you have kept it, that camphor you have to search it here and there. But this homeopathic medicine, you know where you have kept it. So that you take that first. So whichever is reachable first, you take it. So first, so suppose homeopathic medicine, you got it first, you take that, and then you have to wait for another 10 minutes. So that 10 minutes also we should not sit idle. So meanwhile, you can sniff camphor.
Is it connected to heart attack also? This sudden breathlessness?
Okay, yeah, one good question one devotee is asking, that is it sudden breathlessness, is it connected to heart attack? Yes, in some cases, some heart patients also get breathlessness problem. So in such a case, you also check whether you are getting some chest discomfort or not. If you are getting both chest discomfort and breathlessness, so then what you can do is, you put ginger into the mouth and then you keep sniffing Kapoor. So that way, both the things parallelly you are handling. Then what you can do is, you can even mix this cow dung ash in water and drink it, and then that is for the breathlessness, and then immediately put this ginger into your mouth. So that way you can do both the things in parallel. So is it clear? Okay, any questions on this before we proceed further? So this aspidosperma was widely used during COVID time by homeopathic doctors, homeopathic practitioners. So when a lot of people had breathlessness problem, so this was given to them in homeopathic clinics. So people who took this aspidosperma, they didn't have to get hospitalized and they did not have to take oxygen cylinders. Okay, so next we will move on now. Okay, for sudden breathlessness, again some more tips here I'm giving. You have to lie down in prone position. So it is shown there, that person is lying down on his stomach. So why we are lying down ulta like this? Because the lungs actually on the chest, it is on the back side of the chest actually, it is not on the front side. The lungs are slightly situated on the back side. So if we lie down on our back in the usual position, then there will be more pressure on the lungs and they will not be able to breathe freely. But if you lie down on the chest, then in fact the lungs will be able to function more efficiently. And another home remedy I am showing in this slide is handheld fan. It is a small fan which you can hold in your hand. So it is battery operated fan. It is better to go for a battery operated fan because electricity, again you have to find a plug point and connect it. That will take some time. So if you have the battery already ready in the fan, you can switch on the fan and then point it near your face. You sit down like this, slightly bent, and then you hold the fan in front of your face. Now the logic here is that the fan is increasing the air circulation. It is bringing more air near your face. Now because you are having breathing difficulty, you are not able to take in enough oxygen. So that handheld, that fan will bring more air near your face so that even if you breathe a little bit, lot of oxygen will go inside. So it makes the job easier for you actually, this handheld fan. So this is also another option. This also you will get it in Amazon or anywhere about, so it will cost maybe 600 or 700 rupees. You can use it for emergency purpose. So next, instability and low BP. I think earlier somebody was asking about low BP. So low BP and instability are interrelated. So we will discuss these things together. So again, you sniff Desi Kapoor or camphor. So camphor is good for instability and low BP also. And ghee nasya in Ayurveda, because ghee, this is again a brain related problem, instability. So ghee nasya will give more strength to the brain. It will give more energy to the brain so that the brain will take care of the imbalances properly. And the inner ear, our inner ear is also responsible for handling the balance of the body. So this ghee nasya, it will help for all the organs which are above the neck. So ghee nasya is useful for the eyes, for the ears, and also for the brain. So instability, stability, balance is generally related to the brain as well as the ears. So the ghee nasya will work for both. So, but now when somebody is dizzy, feeling dizzy, then you cannot give ghee nasya first, because for ghee nasya first he has to lie down. If he is at home, then you can make him lie down and give ghee nasya. But if he is outside, if you are outside somewhere in the road and if you are feeling dizzy, then it is then ghee nasya will not be feasible there, because you have to heat up the ghee nasya also. At home, you can, even though ghee nasya will take 10 minutes, it will take 10 minutes for you to heat up the ghee. It is not a problem, because generally this instability is not life-threatening. So as long as it is not life-threatening, it is okay to wait for 10 or 15 minutes. So even if you have to, at home, even if you have to wait for 10-15 minutes to heat up the ghee and then apply it in the nose, it will take 10-15 minutes, but it is okay. Because anyway, it's not life-threatening. So you make the person, as long as the person is lying down, he is safe. So you make him lie down and apply ghee nasya if he is at home. But if he is not at home, he cannot, if he is on the road, if he is outside in the office, he cannot lie down. And there is no facility for heating the ghee and applying ghee nasya. So in that case, he can keep Desi Kapoor, that is camphor, he can smell camphor. And he can, maybe in some offices they have this, they have one bed for emergency purpose maybe. So he can lie down in a head down position. If possible, you tilt the bed a little bit so that the head will be in a lower position and the legs will be in a higher position. So that the blood will flow towards the head. The head needs more blood actually. That is because the head is not getting enough blood, you are feeling dizzy. So if you head down position, if you tilt the bed in such a way that the legs are higher and the head is lower, there will be more blood circulation for the head. But again, suppose if he is in an office or on the road where he cannot lie down, then this homeopathic medicine, conium maculatum and gelsemium put together, if somebody is generally has this problem of dizziness, he can carry this medicine in his pocket, and if he is feeling dizzy, he can quickly put 3 or 4 drops in his mouth. So that way, and then within a few minutes, he'll feel a little better. But at least the medicine will take at least maybe 1 or 2 minutes to act. So in the meanwhile, if possible, you can sit down in a chair so that you will reduce your chances of falling down. Because if you fall down and if you get a head injury, then further complications will come. And this 5-phos tonic, that SBL 5-phos that I was telling some time back, it is very good for instability. So if you have that, if the person has that tonic, one dose every 20 minutes, then after 2 hours he will stabilize. Okay, so many of the emergency conditions we have covered now. There are some more emergency conditions which are connected with pregnancy and pain conditions like sudden labor problems or sudden bleeding or maybe sudden pain due to periods time and all. So those things we will be discussing tomorrow, because tomorrow's session will be focused exclusively on women's health. So the Matajis are invited for welcome to ask those questions in tomorrow's session. So I think now, Prabhu, it's 7:45 almost. Burns. Okay, yeah. One devotee just brought up this topic of burn. So for burns, I think in the first slide I mentioned Shatadauta Gratam. It is an Ayurvedic Grita. It is an Ayurvedic kind of medicated ghee which is very useful for burns. You can apply it externally on burns. Either you can apply that or you can apply calendula homeopathic cream on the burn externally. and internally you can take calendula medicine. So this I have mentioned in the first and second slides. Well, they are covered.
Okay. Any other question before we wind up?
Okay, so now I think we are almost coming to the end. There is going to be another session now.
Yes,
Oh, okay.
Ours, anything.
So
Last
yeah,
chance.
we are almost coming to the end of this session now. So any questions on today's topic of emergencies and acute conditions before we wind up? So either you can ask it through audio or you can ask it on Zoom chat.
If you have any questions, general topic, emergency, heart attack, we will tell you. You can summarize today.
Okay, so I will just summarize a little bit. See, I think we may have a few more minutes. So for heart attack, you can chew ginger, chew a mouthful of ginger, and slide. Okay, I'll just go back to the earlier slide. So heart attack. So chew ginger till the tears come out. Put a mouthful of ginger in the mouth. That will expand the blood vessels. It will reduce the load in the heart, and within a few minutes the heart attack will stop. And oil massage in the chest. And there is this homeopathic tonic called SBL cold drops. So that you can take once in 10 minutes till the condition stabilizes. Then for pain management, pain killing, externally you can apply muriganna oil. And if it is a bone or muscle injury, like a fracture, then you have Lakshadi Gugulu Ayurvedic medicine, and Symphytum is the homeopathic medicine. So depending on whether it's a fracture or a muscle strain or an eye injury or whatever type of injury, you can select the medicines from this list. So the second last item is for toothache. Toothache, you can take Plantago, Belladonna and all. If it is, you just generally, if it is a contusion with black and purple patches, then you can take arnica. If it is muscle strain and sprain, it is rustox. If it is bone repair, it is symphytum. If it is nerve injury, it is hypericum. So for each type of injury, there is a different medicine. So depending on, you can just make a mixture of these medicines and keep it at home. And for emergency, you can just take it. You can take it for extreme cases once in 15-20 minutes, and in 2 hours you will get 2 relief. So fits and epilepsy. Onion juice or tulsi drop juice in the nose quickly to stop the fits attack. Then later on you can give ghee nasal drops to stabilize the brain so that further fits attack will not happen. And homeopathic medicine, Buforana and Califos. Califos is a very good brain and nerve tonic, so it will help with this problem. Then stroke and paralysis. Stroke, first thing, put a cold towel on the head so that you can avoid a further attack of stroke. Then you ask the person to chew ginger. So that the heat in the ginger, it will improve the blood circulation. Then that will help with the paralysis problem. And meanwhile, the brain needs some nourishment. So the ghee nasya, the ghee nasal drops in Ayurveda, you apply it in the nose, it will go to the brain and it will stimulate the brain. So the paralysis problem will help with that. And because there may be some internal blood clot in the brain, homeopathy, arnica montana, arnica medicine will help in clearing up the internal blood clot. So all these things put together, if you do these things in the first 3 hours, then in the same day the person can recover from paralysis. But if you delay it beyond that, then it will take some time. Then you will have to give these medicines for maybe 1 month, 2 months like that, so that the person gradually recovers. But in either case, he will recover. I mean, you don't have to, it's not going to be a lifelong problem or a permanent issue problem. But for quick relief, within the first 3 hours, if you do these things, he'll be fine. Otherwise, he'll recover the same day. Otherwise, if you delay it, beyond 7 or 8 hours, then you may have to give these medicines for about 2-3 months. Then sudden breathlessness, you sniff camphor, use Haspidosperma homeopathic mother tincture and
Normal camphor also.
Huh?
Normal camphor we have.
No, not normal camphor. That is why I have written Desi Kapoor. So Desi variety of camphor. Okay, one devotee was asking, can we just use this normal camphor? No, this normal camphor, it will be a little processed. It has to be the pure Desi camphor. So that you can order it online. If you search for Desi Kapoor, you will get it in Amazon also. You can order it and keep it at home for emergency purpose. So this is useful for multiple things. It is useful for breathlessness, it is useful for dizziness and for low BP also. So multi-purpose home remedy. So you can keep it at home. Then you use this small handheld fan to blow more air in the face so that your breathing will become easier, and you lie down in this prone position. Then instability and low BP, again camphor will help, ghee nasya will help. So ghee nasya, camphor and ginger, three useful remedies to keep at home always. And additionally, some special homeopathic medicines are specific to a problem. So one generic homeopathic medicine is arnica, which it is always good to keep at home. Otherwise, other homeopathic medicines are specific to certain problems. And this 5-Fos is a very good nerve and brain tonic, and tonic for all the body tissues. So general overall weakness and debility also, you can use 5-Fos tonic. For improving memory also you can use it, and for general health also, and for emergency purposes also. So my own father, once every 20 minutes I gave him 5-Fos tonic, and he was having instability, and his whole hands and legs were shaking. Within 2 hours he became stable. Okay, so this was about emergency conditions. Then other condition, acute conditions like very high fever and all, we discussed I think 2 or 3 days back. So anyway, all these medicine names I will make a document and circulate it across so that you can use it for future reference. Okay, so thank you everybody for your enthusiastic participation. So we are coming to the end of this. Any questions? Either you can ask now in the next few minutes, or otherwise you can ask me. You can send me message through WhatsApp. I think my WhatsApp number is mentioned in the poster, in the flyer, so you can contact me through WhatsApp.